Hi, I'm Dr. Janis Petzel. I'm a member of PSR Maine on the Climate Committee. I'm a psychiatrist working in Maine since 2001. Um, because of my experiences in working down in Louisiana during Hurricane Katrina, I've been very concerned about the impact of climate on health. I also have a grandson now, and so I really want the world to be a safe place for him as he grows up. So I've been doing advocacy work through PSR for a couple of years now. What we're going to be talking about today is the health crisis of climate change in Maine. Physicians for Social Responsibility, the Maine Chapter, is a membership organization of over 3,000 individuals. It's not just doctors, nurses, and medical professionals. There are health advocates from the community who are also members. The PSR and the Maine Chapter came out with a report called Death by Degrees, which was a groundbreaking report in 2000, and it's since been updated in 2015. So much of the information that you'll hear today comes from that report. There are numerous ways that climate change or climate dysregulation impacts human health. You can see from this chart, it's wide-ranging and very complicated. The three main mechanisms for impact on human health are rising temperatures, weather extremes, and rising sea levels. All of these things can happen in Maine. We're seeing high tides get higher, erosion is happening, invasive species are happening here. We know that climate change is happening here in Maine. So how does that impact our health? We're going to focus on respiratory illnesses, vector-borne illnesses, mental health, and heat, which are the things that are most crucial to Maine. But also we have to consider that what we're seeing with the COVID-19 virus is also related to climate change, in that the things that worsen COVID are also things that worsen climate. So there are sort of siblings of each other, where if you improve the impact of pollution on the environment, if you start to get rid of that and improve it, human health will also improve. So health is a big positive circle where you change something for the better and it impacts numerous things for the better. Disease goes in a big circle down the drain the other way. So we need to stop what's happening now and start to reduce our use of fossil fuels in order to get climate change under control. The first thing we're going to focus on is air pollution and allergens. Maine is known as the tailpipe of the country because of the way the wind blows. So industrial pollution blows our way. Maine has one of the highest levels of asthma in this country. And we can expect that to get worse if we don't make some changes in our fossil fuel use. Fossil fuel burning creates noxious gases, carbon dioxide, as well as nitrous dioxide, sulfur dioxide, and also particulate matter that impacts our respiratory and cardiovascular function. When you add to that the increasing heat days, we have to worry about increasing ozone pollution at ground level. Ozone is a little bit complicated. High up in the atmosphere, ozone is actually protective, but at ground level, it's a very reactive chemical, and it causes almost like burning or damage to especially our lung tissue. It can also cause eye irritation and damage your nasal mucosa. On high ozone days, we can have impaired respiratory function, shortness of breath, coughing, exercise intolerance. And even if you don't have asthma, your lungs can be reacting almost as if you do. With warmer temperatures and longer growing season, Maine's also experiencing higher and higher pollen counts. And if you're a person who likes to be outside, you've probably noticed that the ragweed and the goldenrod are already blooming, and they were blooming in July, which is a little early. So with the longer growing season, we're going to get exposed to more and more pollen, and so more people are going to have sort of a rising misery index with allergies. For people that have severe allergies, between the indoor pollution and the pollen, they have nowhere to escape to. So people with that situation are really suffering more and more. It's not deadly, but it certainly impacts on quality of life. The other, or excuse me, another really serious threat that's being worsened by climate change is vector-borne illness. Um, the main culprit is the deer tick. Mosquitoes also carry serious illnesses. Thank goodness in Maine that's not really an issue yet. Hopefully it won't be, but in the United States we're already seeing uh, mosquito-borne illnesses like Zika coming into Florida. So I don't think they'll get all the way up to Maine, but it's very possible that they'll get closer than they are now. But today we're going to focus mostly on tick-borne illnesses. You can see from the graphs here that over time in Maine, the incidence of Lyme disease has gone up and stayed up. So Lyme disease is really endemic to Maine at this point. The graph on the right shows you the ever increasing cases of Lyme in Maine. But if you'll notice the two lower lines, there are two other illnesses. One is called babesiosis, which is caused by a one-celled protozoan parasite, which is malaria-like, and it causes illness similar to malaria, which is severe flu-like symptoms, and it can even cause what's called a hemolytic anemia. The parasite gets into your red blood cells and it can cause them to burst, causing an anemia. And you can tell that's happening because a person's urine gets dark. So if you notice that's happening and you've been sick, you need to talk to your doctor. There's also an illness called anaplasmosis, which is another type of bacteria that's carried by ticks. And it gets into the white cells and causes flu-like illness. It's very rare for a person to die from anaplasmosis, but in rare situations, a person can get an encephalitis or a meningitis and actually die. Thank goodness that's rare. But all three of these illnesses, Lyme, babesiosis, and anaplasmosis, can make you extremely ill. And we're finding out more and more with Lyme that some of the conditions don't necessarily resolve over time. You can end up with some disability from them. There's also a viral-borne illness that is carried by these ticks. It's called powassan. It can cause an encephalitis and be very serious, but again, it's rare, and hopefully it will stay rare. And then just to make your nightmares complete, there's another kind of tick called a Lone Star tick, which is starting to move into southern Maine and along the coast, and that causes some serious illnesses like Rocky Mountain spotted tick fever and ehrlichiosis. It also causes a strange allergic reaction. The tick shares with you a certain kind of sugar that when it gets in your bloodstream, if you eat red meat, it can cause anaphylactic reaction. So we're going to talk about avoiding meat in your diet later. So maybe that will be, the fear of that will be motivating for us to eat less meat. Thinking about all these creepy crawly things probably makes you want to spray down your yard with pesticides and spray them all over yourself. But just remember, there are non-pesticide ways of dealing with ticks and avoiding them. And spraying pesticides all over your yard actually makes the environment worse. It kills pollinators, it pollutes the groundwater. So even though these things seem really alarming and gross, the best way to avoid ticks is by old-fashioned methods such as wearing long pants, keeping your socks over your pant legs. When you come in from outside, either wash or throw your clothes in the dryer, which kills the ticks, and take a shower. Watch your pets for bringing ticks in. So there are ways to deal with the ticks that don't require chemicals. Moving on to weather extremes. For human health, the impact on human health can be direct. I mean, when a natural disaster happens, people do die directly from buildings falling apart or getting hurt by trees or electricity or drowning. So there is a direct impact on human health, but the more indirect is on our sense of safety. Energy supplies get disrupted, the public health and emergency response systems get overwhelmed. Sometimes hospitals get overwhelmed. We're seeing that with COVID now, which is not really a weather extreme, but it's all, all these types of reactions to extremes have similar courses. There's also the risk of traumatic injury physically and emotionally from weather extremes, and we'll talk about that a little bit more in a couple more slides. The biggest risk for human health directly from the warming climate is from the heat. You can see from this map in the upper right-hand corner that there are places in almost the whole United States where it's projected, and we're seeing in real life, that the average temperature is going up by more than a degree Celsius, which means longer, hotter summers, potentially less cold winters. And in Maine, we like our cold winters. We like our snow. We like our ice. We like our ice fishing. I don't know about you, but my garden soil didn't even freeze last winter. So that means a whole different host of pests coming up here, a whole different host of economic issues from tourism that we have to deal with. But today I'm going to try to keep myself focused on health. So what happens with the direct impact of heat? Of course, there's dehydration. If you're sweating and you can't keep up with taking in fluids, dehydration is a temporary problem that can be easily fixed. But you can also end up with serious medical problems from the heat. It starts out with heat cramps. So if you're out working in the yard or trying to run a marathon or something, or a 5K race or bicycle, or your kids have football practice at school, it can start out with heat cramps. And that's just what it sounds like. Major muscle groups cramp up. Usually there's profuse sweating and you get electrolyte imbalances and the muscles cramp. If you don't pay attention to that and take it seriously, the next thing that happens is you move into what's called heat exhaustion. And ironically, with heat exhaustion, your body doesn't feel hot. It actually feels cold and clammy. It's almost like you're going into shock. Your pulse rate can get rapid and thready. You can feel weak, nausea, headache. And if you don't pay attention to that, you move into what's called heat stroke, which thank goodness is rare because most people feel bad enough that they go in where it's cool. But with heat stroke, your body's ability to compensate for the external heat gets overwhelmed, and your body temperature starts to rise uncontrollably. Any body temperature over 104 in this context is considered heat stroke, and heat stroke can be fatal. So the people who are most vulnerable to heat stroke are obviously people who are exerting themselves outdoors, like construction workers or people working at ferries or various outdoor occupations, but also children and older adults, because their physiology just doesn't cope with the heat as well. In Maine, we have older housing stock, so a lot of our homes are not well insulated and there's no air conditioning. So towns need to take this into consideration and help us by setting up cooling centers on days with hot heat. I saw one article that showed that in Maine, we can expect over the next 30 years, we can expect the heat to advance so that now we have maybe 2 or 3 days typically of high heat index of over 94 Fahrenheit. But by mid-century, it's expected to be over 30 days in the Portland area of high heat days. So that's pretty significant. And, today it's supposed to be getting up to 90 and high humidity, and it's miserable. So this is going to have another big impact on quality of life here. The slide in the lower left-hand corner indicates data from the Maine CDC, which shows visits to the emergency departments in Maine based on heat. It's normalized for rates per 100,000. So the upper line is people over the age of 65. So this just demonstrates that in Maine, as in elsewhere, older people have a harder time with the heat. I'd like to return to the idea of mental health. As I said, I volunteered down in Louisiana in a special needs shelter after Hurricanes Katrina and Rita, and this sort of opened my eyes to the emotional and mental health aspects of what happens after a natural disaster, and it also showed me in ways I'm not even sure I can put into words how social justice and social inequality impact um, American citizens um, during this hurricane and in every other natural disaster. And now we're also seeing it during COVID. What happened in Louisiana was the hurricanes were forecast, so people who could get themselves out of there got themselves out of there and further north into safety. But officials closed down public transportation, so there was no Amtrak, no buses, so people who didn't have cars could not get themselves to safety. So mostly the population of poor Black people were stuck in southern Louisiana with these hurricanes coming. And we saw pictures on the news of people sitting on the roofs of their houses as the water came up. We saw pictures of the horrible things that were happening with lack of food and water and violence happening in the Superdome. What we didn't necessarily see is the emotional impact that has. We saw that the hospitals got overwhelmed, and as a doctor, it's terrifying to me to see so many people in need when I can't do anything to help them. But it also shows how the aftermath affects people, which after the horrible things that people saw and experienced, PTSD and depression were found in people for years after Hurricane Katrina happened, and I think that's probably going to happen with COVID too. So as a medical provider, it's it it cuts at your sense of your purpose in life to not be able to help people or to see your system falling apart. But as a parent and as a person in a community I love, I don't want people I care about to go through this. We're going to talk about social inequity a bit. There are things called social determinants of health, which show that people of color and minorities and the poor end up with poorer health outcomes than people of means. And it's not just because they can't afford to go to the doctor. There are environmental reasons why this happens. It's surprisingly, there haven't been a lot of papers that try to quantify this. So this paper from the proceeding of the National Academy of Sciences is one that tried to quantify it. It's free online if you want to read it and try to understand the math. In general, what this paper used as a measure of exposure to pollution was the so-called embodied energy or pollution cost of things. And so they use consumption as a measure of what part of pollution that each person is responsible for. So what this graph shows is white people in general, which is also sort of a marker for people with more money, people who are less poor, tend to cause more pollution based on consumption than they are exposed to. Probably the easiest line to understand is this graph C over here, which shows that based on the amount of pollution that's produced in this country, white people are protected from it, and people of color, namely Blacks and people of Hispanic ethnicity, end up exposed more to it. And I think we see that in other ways. People of less means end up living in less desirable neighborhoods, like next to coal-powered plants or oil refineries. Back in the day when urban renewal was happening, interchanges for interstates were put right through the middle of poor neighborhoods. And so the people in the neighborhoods on either side of it are more exposed to um, pollution from vehicles. So I think it's intuitive that poor people really get the short end of the stick in more ways than one when it comes to the environment. But this paper at least tries to quantify it. So let's talk about some more positive things. Everything that we've been talking about is kind of scary. It's like, oh my God, things are really getting bad, and we're seeing it here in Maine in our own lives. So what can we do to change that? And I think a lot of these things you already know and are intuitive, but it's just figuring out how to take the next step and putting these thoughts into action. So a lot of it is very low tech. It's just being mindful of how much energy you're using and how much waste you're producing, and do something about that. Luckily, that also saves you money, and there's a connection between um, lowering your energy and your waste and your health. So the thing that surprised me the most about all of this, when you really look at where does pollution come from, and where are fossil fuels really heavily used, and that's in the food we eat. Um, and it's sort of disgusting to think that indirectly we're eating fossil fuels, but we are. So the best ways to reduce the amount of fossil fuels indirectly in your life is to be mindful of the food you eat. Plant-based diet is amazingly helpful in reducing the amount of fossil fuel pollution that happens. And eating no meat or less meat is likewise. So if you can move to a plant-based diet and and reduce the amount of food that you waste, you're already making a major contribution to reducing fossil fuel pollution. Likewise with your house, if you can keep the heat from going out the windows in the winter and keep the heat from coming in the windows in the heat of the day, you're doing a lot to cut down on your need for heating and air conditioning. Changing your light bulbs to LEDs is pretty simple, and it saves you a lot of money. So there are things that are good to do that just take a little bit of motivation and thought and planning and mindfulness. So I hope after you hear something like this, it motivates you to go home and look at your house and see if there's something you can do to start taking steps. In your neighborhood, in your communities, you can work with your town to try to get them to stop using so much fossil fuel. You can be mindful of the amount you're driving and try to either drive less or carpool, although that's not a good idea with COVID going on right now. If you can talk your town into either putting good shoulders on the road or putting in bike paths, people can walk and bike, and the exercise is good for your body, but also good for the environment. We can be mindful of recycling and try to work with our towns to get recycling improved. And you can buy locally as much as possible. Support your local farmers. It's good for the food you consume. It's good for the farmer, and it's good for your local economy. We're going to move now to looking at a sort of higher level of action, which is policy and advocacy. This quote is really important. This is a critical time for public health advocates to demand that political leaders safeguard the health of the world's population, with particular attention to the survival needs of the most disadvantaged. So I think it's really important to remember that pollution doesn't stay in one place. Temperature doesn't stay in one place. When we focus on people who are most disadvantaged, we're also making the world a better place for ourselves and for our children. There's lots of policy and legislation options, such as changes in the tax codes, talking about pricing carbon emissions, emphasizing renewable energy sources and energy efficiency. So Efficiency Maine does that here in Maine. So if your furnace stops working, I hope you can consider switching over to something that's not burning a fossil fuel for your heat, and some of these policies can help you do that. I think it would be great if We can encourage our government to incentivize renewable energy and stop um, uh, supplementing the incomes of the fossil fuel companies. But that's all going to require policy and advocacy. So I hope as we go into the end of this talk that I've encouraged you to take action. Um, there are lots of options for you individually. If PSR's mission is of interest to you, we welcome you. I'll give you contact information at the end. I think I forgot to say this at the beginning, but what PSR tends to focus on is nuclear safety and dearmament, climate and health, and then reducing the amount of toxins in the environment, which includes things like reducing BPH and um, um, children's drinkware and pesticides, that sort of thing. We welcome volunteers, and I hope you do get involved. Email or call or send messages to your legislators. Sign a petition. Voting is always crucial. And you can influence your friends and neighbors by, in a positive way, by sending a letter to the editor, an op-ed piece. And in Maine, we're very fortunate that we're a small enough place that we actually can have the opportunity to know our legislators in person. So take the time to get to know your elected officials and talk to them about your concerns. And finally, at the state level, our legislators really take their constituents' thoughts into consideration as they vote. So if you have a story that can touch your legislator, you can have a big impact on the actions they take. So consider giving in-person testimony. I want to thank you for participating in this talk. Here's our contact information, PSR Maine, it's psrmaine.org. And you can also contact Karen at psrmaine.org, or there's our phone number. Thank you very much.